Hello, dear colleagues. It will be a pleasure to share with you this new device from Candela, the GentleMax Pro Plus. It's the latest innovation in laser hair removal, among others. For us, we know that it's the gold standard with the possibility to have two wavelengths in the same device. It's well known. And Candela is a competitor since more than 15 years. Probably the inventor of the technology, and to have the both is really a plus for any doctor who want to be to have an indication in the on clinics on depilation on other. For us, alexandrite, it's well-known wavelength 555 is the best wavelength for hair removal from phototype 1 to 3. For be aware for all pigmented lesion, because as we know, with this kind of wavelength, you can to be absorb any superficial pigmentation and vascular lesion. It could be a good discussion because it's probably not the favorite wavelength for vascular lesion. I prefer to use our Prima because we have also a Prima in our clinics, and it's easier. But today we have to speak about alexandrite and Nd:YAG.
There's Nd:YAG on this laser also for hair removal for all phototype, including 4 to 6 phototype, and it's okay for residual tanning. But you have also real vascular laser in this device. You can treat vascular lesions. It's the same Nd:YAG that you have on the Prima laser, and you can really treat vascular lesion, wrinkles, and diffuse redness. There is a device dedicated to vascular lesions with a 3-4-10. I don't know if you see it, but it's a 3 on 10 millimeters device to treat vascular lesions, small vascular lesions. We will see it later. So this laser have more energy. It's very it's for effective fluence plus 28% of energy in alexandrite plus 13% of energy in Nd:YAG. So it permits new fluences on 26 millimeter for hair removal and a higher maximum fluence for larger spot size.
Yes, the spot size is very common to understand. It's the biggest you can find on the market. And until 26, even that we know that if we compare 26 to 18, you lose fluence on energy. It's always a balance between fast treatment, but you have to keep in your mind that you have to be effective. So the good balance is: do you start with a large spot and you finish if you need more fluence with a smaller spot size because you have less density of earth? It's always a good question maybe to have after in the Q&A. So it's a balance, but we know that if Candela put in the front of his device, he said that you have a larger spot. Agreed totally, but for me, because I have to pay every day for my laser, I keep in your mind that less you have a spot, less you pay when you have to change your lamp after 1 million or 1.5 million shot. So it could be a good option to understand that less you have a number of shots, more you spare money. Maybe just if you count just the shot. So it's very important to have that in your mind. Even the most important is to have a good result and be aware that the possibility to change the size is not only for money, it's also to be fast, but to be efficient too. So very important that we know that now we have a large range of possibility, and Candela with the GentleMax Pro Plus can offer that to your patient and to your practitioner.
The second revolutionary pulse duration permit 2 milliseconds for hair removal. So less thermal effect, more selectivity, and more efficiency on residual hairs. It's a safer mode and more efficient, more comfortable, because pulse duration is 33% less than the 3 milliseconds. Just 1 millisecond, but 1/3 less than a classical laser.
So possibility to have a high-speed treatment, always the same. So if you are a clinic, if you work alone, if you share with colleagues, it's always a possibility to offer to your patient on to your schedule high-speed treatment. It's a record. But be aware that when with the mode hyperboost, it's always the same. So when you glide your device on the skin, be aware, because some colleagues will receive a lot of young practitioners in our clinics, and we are experts for that. And it's sometimes funny because some colleagues shoot, but when they don't apply the chips, so it's not so easy to be square with a fast motion. It's quite a fast motion because it's 3 hertz is very fast. So be aware, you have to be concentrate, because when you start 1 hertz, it's okay, 2 hertz, it's okay, but 3 hertz, and to maintain 3 hertz, it's not so easy. So be aware, and you can use 3 hertz for any area. On face, no interest, because it could be a little painful, and patient could be a little afraid, and access with a laser. And for back, it's very interesting, and for buttocks, for legs, it's okay, but be aware for the bikini or décolletage, it's sometimes a little painful, so you have to reduce. So it's a possibility that this device can offer to you, but be aware, you have to are you capable to do that? 3 hertz is so fast, but you have the possibility to do that. So if you can compare the size with the different size, 18 to 26 with 2 hertz, if you increase, it could be more faster, more faster, but always the same questions. Patients don't forget that patient they pay for something, and if too fast, sometimes as you're very surprising in our clinic, they say, but that's finished. You know, when I start laser for depilation 25 years ago, with an IPL, you know, you can imagine, and the difference now today, and a patient was surprising because it takes maybe 1.5 for legs, and now it takes 30 minutes. And patients, all patients, they coming for with our daughter, and they change in 25 years. They say, but now, you know, you stay a long time, 25 years ago with me, and now it's only less than 30 minutes. And, the price is double. I said, yes, but technology changed. The tax, many things change, and now you pay more, but to have a faster, and sometimes it could be painful. Say it's painful. Do you want to suffer 1.5 hours or just 30 minutes? It's always the same question. So it's a good balance. So now you can offer that to your patient. If you have time, you can stay just in one hertz, but you are in a faster condition, or you have a clinic and you need to have a lot of return, or if invest, you can use 3 hertz, but not so easy to stay 3 hertz for a long times. You have to stay concentrate. Next.
So this laser has same performance in Alexandrite mode or NDYAG mode. You can tweet all phototype with this 2 wavelengths. You can perform skin hair removal with residual tan, summer, winter, NDYAG permit to tweet with residual tan. You have a true vascular laser with the NDYAG laser. You can treat vascular face and lower limbs, like small vessels on the lower limbs is a great demand of your patient. And sometimes when you perform hair removal, you can discuss with your patient, and they ask you if you can treat these small vessels, and you have the response. you can treat them with the same laser. You can also treat pigment, but it's not a laser to treat pigment. If you just want to treat pigment, it's not this laser you have to buy. But there is additional indication like warts. Warts can be treated with this laser, but it's painful. So you have a wide range of indication to adapt to all type to dermatoaesthetic activity.
About skin cooling, we have two possibilities. The DCD, because Candela was the inventor of the system, this system, and it's very interesting. For our part, we use DCD just for our Prima because it's easier. And when you treat face, it's less comfortable to use DCD than Zimmer. But for hair removal, we prefer to use Zimmer. It costs less, and the reasons is that sometimes we need and we use two Zimmer for fast treatment with high frequencies, and we use so both. You will see some video just after the presentation. So it's a good balance. We have the both, but one for Prima, the other for hair removal. For on practice, we prefer Zimmer, but it's your own problem. Just to mention that with the system of DCD, you have to be really clear to be sure that the system of the cooling system is full on the size you want to treat, or the spot size on the area you want to treat, because sometimes if you are not square and you do point really perpendicular to the skin, the risk is to have a burn. It's a moon burns, so be aware. It's an elliptic burns. It's very well known for colleagues who see some complication. I believe that you have the less risk with the Zimmer because you spray a lot of cooling air on this area, so it could be less problem for me, but for my part, in my own experience. But you have the choice. So sometimes you have less plume with the system DCDs, and with the Zimmer you have a lot of carbon projection, so we need the aspiration system to reduce the odor on the carbon size in your room where you treat your patient. So be aware, but you have the possibility to change when you want. So it's an optional external cooling system, DCD system or Zimmer.
DCD can be an advantage for the face treatment because there are no air jet in the face, which could be discomfortable for patients. So DCD, if you have to treat face, could be a plus.
Yes, or for hair, by example,
Yes.
with the Zimmer, it's painful, so you have to cover and to make something inside to reduce the pain due to the hair cooling. With the DCD system, you have not this problem. But I believe that you are not the first. For your first indication is not hairs, probably.
So you can treat vascular lesions, so vascular on face, on the lower limbs, like small vessels on the limbs. You have the high influence on the market, up to 500 joule by centimeter, so it's a very high fluence. You are not limited to treat vascular, but be careful if we treat to 500 joules. You have dedicated spots, 1.5, 3, and the elliptic spot on 3 to 10 millimeter. It's a very good tip to treat the vessel with lower limbs and with a better thermal damage. You don't treat the area, all the area around the vessel. You have just to treat the vessel, and you see what you do. It's very high satisfaction to treat vascular lesion with this laser.
Yes, the pigmented target absorbs your light with alexandrite, because we speak about alexandrite for pigmentation. So you can treat lentigo, pigmented spot, photo rejuvenation. For lentigo, be aware you have to reduce the time emission. So it's reason you have ultra short pulse. It's not a pico way. So if you have a Prima, if you have a pico way, or if you have the GentleMax Pro Plus, you can try and treat many kind of indication, but you see with only 2 wavelength with a long pulse emission, you have many condition, many indication to treat and to reduce. It could be difficult if the lentigo is very light, but for most of them you can reduce and it's easier. You have just to see with your eyes and with your ears to see that say just after the shot, the pigment lesion is gray, and it's very easy to do on face or dorsum of the hands, and it's very precise. It takes time, okay, but sometimes you have also rejuvenation. You make a stacking with a larger spot, and you make many passes, and after a few passes you will see lentigo dark spot more with a more contrast, and that means you have an absorption, and the patient have clearly after a few sessions between 2 to 5 sessions, and you can combine with your PICOA and sometimes also Prima for photorejuvenation. Also, you can have a mix of device. You can really clearly clear the skin condition of the patient, and they are very happy.
So complementary indication like VARTS, you can treat VARTS with alexandrite or YAG laser with a small spot. I don't treat onychomycosis with this laser, neither keratosis, but to treat VARTS, it can be a complementary indication. So let's see clinical cases and parameters. This patient has to treat facial hair. Parameters are with alexandrite mode, and 20 millimeters, and 40 joule of fluence, 3 milliseconds, and 1.5 hertz. You are not limited with the power, the fluence to treat face, and you have to use high fluence to reduce the paradoxal growth. Another patient to treat facial hair, and this time I choose ND-YAG mode, 20 millimeters, and 17 joule of fluence. You can up to 20 joule or 19 joule of fluence with 3 milliseconds. And you can see it's not a painful act, and it's a very fast act. Another patient with same parameters, just to show you that you can see the hair are treated and the change of conformation just after the laser.
But you don't treat white hair. I see some
No,
white hair.
you can't treat white. With any laser, you can't treat white.
Yes, I like to use this device because we have other device for depilation, but that one, we have assistant and young practitioner or young colleagues. And if you want to know it's a good laser, you put a new practitioner with this device, and you observe how we handle and how we use. And it's funny to see the difference between different device for depilation. For other laser is the same. And to see this one is very comfortable because the hand bead is okay, it's light, it's easy, it's very easy to see what you see. Some device you don't see anything. With that, you have a gauge. With that, you have no risk to burn onto where you are. You focus. So it's very secure for young practitioner, for your assistant, or for nurse. For the first passage, I defocus. I'm not really close from the skin, just because I'm lazy. I don't want to shave my patient just before because she really completely upset by that. So what I do, I burn the superficial and external hairs, and I remove with my gauze, my tape, and just to reduce. And after that, I treat the patient really. So it's a double treatment, but the first one you have no efficiency because you have too far away from the skin. So it's just to remove and to cut and to shave by my laser some hair because they are too long. And after I treat really, it's not a problem. You can see that this patient she has hormonal disease, so we give some tablets like spironolactone. It's a preamble. We do a lot. We combine the both because we are always afraid by the paradoxal ingrow or growth. So it's very important, and we combine. At least we are doctors, so we no problem to explain to a patient, and we have an co-partner is endocrinologist. So if we have any trouble with hormonal disease, we have no hesitation to combine the both with hormonal treatment and for face or for sometimes for body if you have hormonal disease. But some patients have the blood test is completely normal, but we give spironolactone because we know that the risk is very high. If you stay in the medium face, it's okay, but if you go to the lateral part of the face, the risk is very high. So be aware with that. And you will see on this patient, she has a melasma. So it's always the same. It's not an hyperpigmentation, but it's quite the same. But melasma, it's not so easy to manage everybody. So, but you see the absorption just after she have a more contrast, she have a little redness, but it's not really a problem. We have 2 milliseconds. We treat a lot of patients who is pico or nano laser for melasma. Even we know that it's not the mandatory to treat melasma because we associate a lot of cream or pills or many things or tranexamic. But for the patient, we are not afraid. But you have to inform your patients that the risk that the melasma will decrease, but after a few weeks it will increase because the risk, if you induce an inflammation, the risk is to re-grow the melasma. So you have to inform your patients, and we treat in the same session. We apply some corticoid and sometimes with hydroquinone to reduce this risk and to treat the both. So it's the first pass, external hair removal look like for lazy boy, and the second pass is really to treat the patient, and we'll see the setting. It's alexandrite. I'm less afraid as my colleagues. Probably my co-partner will his first setting would be NDYAG, but me I no problem to use 555 alexandrite wavelength. 10 joule is not so bad on 2 milliseconds because it's a velocer. But I take time because I know that it's painful, so I don't put 2 hertz or 3 hertz. I take time and apply. We see. I take my time to treat the patient to reduce the pain. So very important. No, it's always me. Yes, the same. It's for shoulder on no, it's not shoulder.
Legs.
It's
Legs.
legs on women. High frequency, high for me because I'm old. 3 hertz is too short, too fast, and with 2 milliseconds is very fast. It's not a fast motion, but it's quite the same, and because it's sometimes low, it's not so high energy. I believe that the maximum is 12 or 11 joules. Clearly at the maximum with 2 milliseconds with 3 milliseconds, you can reach the 15 joule, I believe. But sometimes I make a double pass. And I try to observe that we have a papule just after, so I have no problem because it's a large post, it's fast, and to avoid to forget some area untreated, sometimes I use a double pass in the same session. So first pass fast, 2 milliseconds, and I repeat again. It could be happened. It's not for all patients, but I'm just looking just after the session if it's enough. If I have some papule, it's okay. If you have no papule, sometimes I do the same. I repeat. It's not the end point, but it could be better if you have this some papule as an end point. For the décolletage on a young man, it's always a challenge. Most of the time, I refuse to treat really my practice because I try to tell you the truth. Be aware with young patients, it's more difficult. After 35 years old, it's okay. But for young patient, you have to inform that it will be okay. After a few sessions, it's open, but the risk is to have some vellus error with less density, but it's not all of time perfect. And so sometimes patients are coming just for summer, and we make 1 or 2 sessions just before summers to be okay for all during the summer and to be without any error of this area. And just after you see the area, it's a little painful when you see even it's only 10 joules, but fast 2 milliseconds, 24 millimeters, and it gets very fast. You will see the result. It's less than 10 minutes, maybe for the torso. Another man. Exactly the same, but I increase. It's 3 milliseconds. And increase. You see the papule, just the papule after. So I believe that the result will be better. But be aware, it's really painful. Sometimes you will see the fasciculation of the. It's like a magnet for like IFM. It's not for the muscle, but it's little painful because you induce contraction of the muscle because patient it's little painful. So it's reason sometimes I use a double Zimmer. This case, not in this case, but sometime maybe the next one will be that, and you will see the fluence with the previous it was 18. With this patient, another one, easy, fast, not so painful. Is there really is depend, now 26
millimeters, so it's a very large spot, but 2 milliseconds and 11 joule. It's the maximum, but it's a very, very high efficacy. Just 1 Zimmer, so but it's not painful, and it's a very fast treatment. Oh, it's your shoulder.
It's my shoulder, so I use a double. 24, 12 joules, 2 milliseconds, 2 hertz, maybe 3, I don't remember, maybe, because it's fast. And I prepare the area with my previous YouTube, with my 2 armpits, so you need to have 2 hands, one to treat, one to clearly to freeze and to numb the skin. So with a large spot, it's okay, patient agree. Thank you.
Thank you.